COVID-19, as we know, is a respiratory-based illness that is transmitted through air droplets and affects everyone differently, but most importantly affects individuals over the age of 65, as well as those with previous underlying health conditions that suppress their immune system. This leads to severe conditions with a domino effect, creating situations that lead to breathing difficulties and lung damage, hospitalization, ICU admission, or death. The information given on immigrant health data is limited, and we can only go by the conditions in which they endure in Immigration and Customs Enforcement detainee facilities, where varying levels of the virus in different individuals exist based on symptoms that are medically underserved and disorganized. Immigration enforcement has put preventive measures into place to reduce the likelihood of transmitting COVID-19, such as prioritizing at-risk groups and reducing social visitation, but none seem to uphold the conditions needed to quarantine safely from the disease.
An urgent plea from behind bars. Don't let us die from COVID-19.
This will turn our detention into a death sentence because this pandemic requires social distancing, and that is impossible in this environment. They are not able to handle this outbreak. There is no screening, even for those with symptoms.
This is a cruel and completely inadequate way to deal with the crisis at hand. It does not comport with medical expert advice, and it essentially makes sitting ducks out of detainees in ICE facilities.
And even though most of the country is on lockdown, ICE agents are still busy arresting and confining undocumented people.
Minority groups, much like the undocumented Hispanic population in the U.S., are predisposed to having a higher rate of chronic conditions, malnourishment, and risks to their immune system, making it much easier for the coronavirus to flourish in cramped detention facilities. The emotional tolls put forth by tight living conditions within these facilities creates a trend of poor mental health for the immigrants and their families, in which a lot of families have another reason to be torn apart from each other, increasing the amount of stress and fear in children and adults that adds to the fragility of getting COVID-19. With the vulnerability so high for immigrant populations, the pandemic is the time to define a system to inform and address the prevention of disparities by allocating the right programs and resources at different levels of society. In response to the pandemic's stay-at-home order, ICE officials took their chance to obtain the possession of illegal immigrants in the face of the disease that halts your location, while they continue to claim that their best interests are for the safety of the individuals fighting this pandemic.
Yeah, it really shows, I think, that ICE is committed to undermining public safety and public health, even in a time like this, even in a pandemic where the governor is ordering us to stay home in order to safeguard the most vulnerable in our communities. ICE is out here not only creating more contact, but creating chaos, creating fear. I would say removing any incentive that immigrants in our communities have to pay attention to federal authorities or local or state authorities, because you hear one thing from one part of the federal government, and then you have a practice that is totally undermining public health, which is to continue these detentions as normal. It makes no sense at all if what we are actually trying to do is, as a society, stop this pandemic from happening.
Faults in our country's societal framework create the poverty-stricken immigrant communities that are vulnerable to the coronavirus due to their poor, untimely network of affordable health care and the fear of repercussions if they were to seek help or be increasingly exposed. Overall, we need to realize that the Hispanic immigrant population structures the backbone of the labor force of America, pushing these families into the gray area of institutional and systemic safety, where they benefit the least in their own economic progress and social stability, making it hard to ever emerge from disadvantaged presets in the face of the COVID-19 pandemic and the way it has affected our country today. As the pandemic progresses, we look to solutions that will improve the disadvantages within immigrant populations. Individuals have no way to bypass the president's executive orders when it comes to the increased prevalence of ICE raids and detainment, but we could work through loopholes by attacking those who support them. Wealthy tech companies enable these orders backed by the president, where they provide the infrastructure needed for ICE agents to find targets, conduct raids, and make arrests. It is important to petition against these tech companies in order to halt their support for ICE and potentially create a barrier in their operations during the ongoing pandemic. The U.S. government must take all measures to reunite separated families, to provide reparations to affected families, and most of all, to enact systemic changes in accordance with international standards to ensure an immigration enforcement system that is free from coercion and has strong safeguards to prevent torture and unsanitary confinement in compliance with proper COVID-19 quarantine procedures. As the American Immigration Council states, ICE should use its broad authority to parole people and release them on alternatives to detention to the widest extent possible while their immigration court proceedings continue. ICE should limit enforcement actions that put communities at heightened risk due to COVID-19 by implementing meaningful enforcement priorities.